Rogers TV. This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome as a guest to our program, Jeremy Woodley. And Jeremy is here today to talk about care services for seniors and special needs individuals. Welcome, Jeremy. It's been a while since we've had a conversation.
Yes, it certainly has. How you been?
Good. And I know you've been really busy. So we're here, to talk about seniors and special needs individuals. But I'm wondering first if you can tell us a little bit about Woodley Services and how long you've been going now. It seems like a while, and how you've grown.
Yeah, sure. So we've been around since June of 2014, so we're coming up to 11 years.
Yeah.
And we started with just myself, and then a friend would help me here and there. And then from 2017 to 2020, I had a handful of staff, and that might have been when we last spoke on here.
Wow. Yeah.
It has been a few days. And then really since 2021, it has just blossomed to where now I've got over 50 staff. We currently support around 70 families, give or take.
Yeah.
Yeah, no, so we've really grown quite a bit. I've been around, we cover everything from like your elderly, so anything from dementia, Parkinson's, Alzheimer's, multiple sclerosis. We deal with autism, fetal alcohol syndrome, Down syndrome, cerebral palsy, ADHD, just kids with just learning disabilities, any physical disabilities, or just, maybe some kids who are just needing a big brother or big sister. We cover all that as well.
So what got you interested in providing this service? How did it begin?
I was a PSW from 20 years ago, and I tried for nursing and that fell through. And I'd worked many years with community living. And then my addiction recovery background, I worked at Gene B House for several years. And then during like the late winter of 2013, early 2014, I was on a stress leave. And I had a period of burnout depression, to be quite honest. And I nearly went back to my hometown of Brantford. But then everybody's like, why don't you just go on your own? Thought about it. It's like, it makes more sense. I can stay in the area I really wanted to stay in first, because I've been here for a long time.
Yeah.
And this is market for what I'm doing.
Yeah.
And I really thought, well, the baby boomers were coming, and there'd be enough need to work with passport and special services at home to do a respite with. I thought, yeah, I could make a go of it. But I never imagined we would have COVID, and then the doors of healthcare would be blowing off, and we would be where we are today.
Yeah, amazing story. Just amazing story. And I know that I've seen that you're a very active sponsor of community events as well. Like, it's not just a business, that you do reach out and support different community initiatives. Did you want to mention a little bit about that part of what you do?
Yeah, so I got we sponsoring the upcoming Seniors Fair Trade Show coming up May 13th through the Old Sound Chamber.
Yeah.
And I like to sponsor various golf tournaments and other local events. Yeah. And it's not just to get my name out there. There's needs everywhere, so if I could help in any little way I can. And just have some fun meeting people, networking, making a difference to somebody that you may not have met otherwise.
Yeah. Excellent. So for someone who's watching this program and they're not even sure whether they could use the services or could afford the services, and I'm not asking for specifics about your dollar figure, but how would a person find out about whether they'd even be able to access your services? Is it all private? Is it insurance covered? How does it work, Jeremy?
Yeah. So for home care, it is all private, so families would pay out of pocket.
Okay,
Some families do have an insurance policy that covers it,
okay,
and then we submit them a invoice weekly, and we keep track of it all, so they can submit it on income tax time.
yeah,
So yeah, so they in the case with on our respite side, a lot of them have government funding that comes with it, so that pays for like the ones with special needs,
yeah,
and then yeah, our rates will vary depending on what if you need nurses or just companionship.
yeah,
It's not often we get nursing inquiries, but I do have access to nurses if we
hmm,
need them.
yeah. So the environments that you work in, because you mentioned autism and you mentioned seniors and respite. So whereabouts do you provide these services?
Most of it's in their own home.
Okay,
Yeah, we are in the family's home. We do go into the nursing homes and retirement homes. Actually, just before I came on the air, I was filling in for my wife at one of our local nursing homes, assisting with a client over lunch. So, yeah,
yeah,
we go into their homes, and then we like to, especially when we have our special needs individuals, we like to bring them out to the community as much as possible. Like we do help with in-home respite,
okay,
but we also I like to organize different events like the Attack games, the Leaf, Blue Jays, Raptor games. Last year we had a bus full going to Canada's Wonderland. So we try to do a lot of fun stuff to give them experience they won't forget.
yeah,
The staff can have fun with them too as well. So
yeah. So it's both it's a social activity that you're involved in as well as not just healthcare.
right.
Okay. Yeah, that's helpful to know. Now, are you ever involved with school systems? Do you ever,
Um, we we're trying to get into them more. Um,
okay,
I do actually have a few EAs that have worked for me, usually in the summer or some weekends.
yeah,
We help with schoolwork at home and whatnot.
yeah,
We haven't been asked to go in as much with the school system, but some of the work we do coordinate with because for the high risk behavioral ones, we need to collaborate with some of the school to make sure from the school to the families to us are sticking with any structures and plans to make sure there's consistency.
yeah, yeah. So that everyone works together
Right.
with the same approach. Yeah, that certainly makes sense. So staff, now you mentioned you now have 50. Wow, that
Mm.
that's a lot. What are some of the qualifications that you would be looking for? And how do you find your staff? How do you screen for your staff?
So the qualifications, we look to see if they've got the personal support worker certificate, DSW, or any related caregiver experience.
Okay.
And as long as they got a police check and it's clean and first aid CPR, and we send them through that. We send them through safe management training, so that teaches you it's like the non-crisis intervention. So it shows you how to defend yourself.
Yeah.
And then I am actually coordinating with the Geneva Center in Toronto to have them come up here this summer, and they're going to give us some ABA training this summer.
Now, I'm not familiar with the Geneva, so
Yeah,
could you
so
elaborate?
they are for autism,
Okay.
and yeah, so safe management training teaches you how to defend yourself and
Yeah.
gives you like, how to block and get out of certain holes without hurting the individual or yourself, and to get
Yeah.
out of the way in time and de-escalate a situation.
Yeah.
And because we are getting a lot of autistic individuals, I felt it was best the more training, the more education, the better.
Yes. Yeah.
And yeah, so the Geneva Center will come out and they can give us, with the volume of staff, we need 2 days to cover everybody. They give
Mhm.
them a skill set, tools, confidence that they need to troubleshoot situations. Then they're not always relying on us to intervene.
Right.
And then this way you don't miss a beat either. Everybody will be on the same page, same playing field.
Yeah.
Yeah, so we're looking in any extra courses I can find. I make sure everybody goes through that training.
Excellent. So it really is, you bring people on who may have some experience, but recognize that, like you say, you've got special individuals that you need perhaps to have additional training for
Right.
those unique needs. What do you hear back from your workers, those who are out in the field? Um, what do they
Well,
say?
I'm proud to say a lot of them love working for me, so that makes me feel good.
Yeah, yeah,
Yeah.
that's always a good thing.
Yeah. I, for the most part, I'm able to keep. I've had a lot of them who've been with me for quite a while now. I mean, you don't get to keep everybody, but that's anywhere.
Yes, yes,
uh,
yeah.
I know
And they enjoy the experience of working in homes because it takes
I
special skills, and it wouldn't appeal to everyone to do that.
right. A lot of them, yeah, they like the pace they can work at. I try to work with their schedules, and for the most part, that's what's favorable. When they work for me, you're not just a number. You're
Yeah,
valued, you're cared for, you're appreciated.
yeah,
That goes a long way. I may not be able to compete with other government ran agencies that can have the bells and the whistles that we all like, but
yeah,
they make they're making a good wage. They love what they do. They like a set schedule that's favorable to them.
yeah,
And sometimes that can go a long way more than anything else.
yeah.
And
It's
the
a
fact that they
quality.
feel
Yeah,
really validated and respected and cared for as an employee
yeah,
and as a person.
yeah, yeah.
Um,
Yeah. And that is important because then if you're satisfied with your job, it comes across in the service that you're able to provide.
right.
Can you tell me a bit more about you use the phrase respite services, but maybe for those who are listening and our viewing audience, what do you mean by respite?
So respite is caregiver relief.
Okay.
So I guess we'll use you and Mark as an example, since we're so let's say you're Mark's caregiver and you want to have a break. You want to say go for 3 hours one afternoon,
Okay.
and you want somebody to sit in with Mark and somebody to keep him company. You're worried he's going to fall. He could burn the house down. So I would come and keep him company, keep him safe.
Okay.
And then while I'm there, if you need help with laundry or cleaning, or just strictly companionship, just to play cards, just make sure he's safe and that everything's good. So that way, when you're out and about doing your shopping errands or visiting a friend, you can go have a peace of mind knowing Mark is taken care of.
Yeah. And that's important. Do you do overnight respites as well,
Yes,
Jeremy?
we do. Yes, we do.
Okay. So if someone wanted to be away um, for an overnight,
Right.
that's available as well.
Yes, it is.
Yeah. It's an important service that not every agency is able to provide,
Right.
the respite care for sure. What about doctor's appointments and dental appointments? How do you help with that?
Yeah. So we do a lot of rides. Just yesterday, I drove a family to London,
Wow.
and yeah, we do a lot of escort. We go to the appointments with them. We drive them from point A to point B. Now, and we pay the extra insurance for it.
Hmm.
No, I don't have the wheelchair accessible vehicle. So a lot of the times the family still have to pay for the HCSS vehicle, but we can still go on the bus with them and go inside their appointment, take notes for the family and stay
Okay.
with them. Yeah, so we do a lot of that.
So in other words, you link with other services to be able to still provide the package of care that would help someone to get to the doctors.
That's correct.
So when you say HCSS, that's Home and Community Support Services would have the van, but your company would provide the person to go with the individual and go in to the doctor's appointment.
Right.
Okay, okay. So that's helpful to see how it connects. Are there other organizations that you connect with as well to provide care?
Yes. So, and from the home care side, VO1 Care Partners, they will refer my name. So families needing the extra private care, they will refer my name to them.
Yeah.
And
And
then
Alzheimer's Society, how does
I haven't had too much of them, but they do know of me. I think they do pass my name along, though.
yeah, yeah,
And I do partner with Community Living a lot. They have come to me because I used to work for them.
yeah.
Several times they have asked me to, uh, as a third party, to be subcontracted to help out. So
Yes,
it's
Yeah,
nice when everybody bonds together.
for sure. So you've mentioned how your organization, your business has grown. Tell me about the trends that you're seeing in our community and some of the needs that you may not have expected 5 years ago.
I think, especially during the COVID years, when there's a pandemic and an outbreak of any kind of illness, you can't go see your loved one in a home. And the waiting list of the home. So it's very paramount to stay home as long as possible.
Yeah,
I found like, yeah, because I've been worked in palliative care where the client, there's a piece about them knowing if they're at the end of their life, they want to go in the peace of their and comfort of their own home.
yep,
So there was a lot of that. And especially in the autism side, there's getting to be a lot of where two staff are needed just because of the physical, behavioral, violent nature some of them
yeah,
can get to.
yeah,
I knew with autism, it is so routine oriented. And during the COVID years, like routines got ruined and disrupted, and they wouldn't be able to understand what was happening.
yeah,
And I do hear from families like that led to some of the behaviors with their loved ones that they never experienced before. So you are seeing a bit of a trend where, in some cases, two staff are needed. But then, in a couple of cases, over time, they were once they had some structure, routine, getting everything back into place, they were back to only needing one staff.
yeah. And
Yeah.
we don't, I guess you don't think of that
Right.
as a result of COVID, but that certainly makes it clear. Would that be the same for people with dementia who are used to routine as well?
Yep. Absolutely.
Yeah. So those who have Alzheimer's or dementia, that where routine and the same faces are critical, because I didn't, we know about COVID, but
Right.
what you're describing is a change that happens when people experience a change in routine.
Right.
Yeah, yeah. And so from your perspective in the referrals that you get, um, do you have more of a certain, are you more with autism or seniors, or is it equally balanced? What are we seeing in our communities?
I'd say right now, at least for Woodley Care Services, we're steady year round, which is good.
Yeah,
And I find there are certain periods that they were busier than others.
yeah,
I find right now we're busier more on the respite side with the special needs. The home care goes up and down, but I think that's just more families are just, they still like to decide what they need for their families and whatnot.
yeah,
And
yeah,
I think still people still try to get families and friends to help out home more.
yeah,
And
yeah,
what I also see, like, yeah, with, but in either way, you're never really out of work, especially in this area. Like,
yeah.
I did some research recently, and currently 20% of our population are baby boomers.
So that we're getting up there,
We're
Jeremy.
getting up there. So I can, I've been around a while, but I think we could just still be in the beginning of what's coming.
Yeah, yeah. And that certainly will increase the need for your services. What about, we often hear how important it is for people to stay in their homes, but you mentioned laundry and maybe meals, but what about outdoor maintenance and that sort of thing? Is that a service you provide, or is that something that you refer others to?
That's something we refer others to.
Yeah,
Like if
yeah,
we're there, we'll shovel their steps and what have you.
yeah.
But depending on, because legally as a PSW, we're only allowed to do so much. Like we're allowed to
Okay.
cook, clean, do laundry.
Yeah.
We wouldn't be able to do anybody's gardening, for example.
Gotcha,
Yeah,
gotcha. It's more the things related to personal care as
they're
opposed
right.
to, yeah,
Now, having said that, of one of my staff got asked, and they felt comfortable doing it, and they knew they wouldn't hurt themselves doing it, like strain their back, for example.
yeah, yeah,
And if they asked if it was okay, then I would more likely approve it. If it helped the client out, if they felt confident,
yeah,
then we could be like, yeah, sure. But we try to stay within our scope of practice to Like there was little extras we can do, but you still want to stay generally within your scope of practice too.
Yeah. So how do you screen people for whether when you get a referral, what do you do for an intake? Like how do you do your assessment? And then how do you figure out how to match the, the worker with the individual?
Right. So we have a list of everything we cover, and then we ask them what exactly do you need, what how many hours do you need, what how many days a week, what time of day, and
Yeah.
then they check, and then like, oh, okay. And then we see who's available. Like already, there's going to be some who are already full with a set schedule, so we know we can't ask them.
Yeah.
Usually, the ones that need a bit of a top up here and there, we ask them first. We
Okay.
go with the skills, who's got the demeanor, who's got the. And
Mhm.
usually, no, when it's just companionship, then I'm usually able to send an EA or a PSA in if the personal care is not needed. Anytime personal care is needed, it's absolutely a must. A PSW must go in.
Yeah.
But in the case of it's just like companionship, making a meal, playing cards, doing some laundry while you're there, then I can send a PSA that's experienced and still well trained.
Yeah.
And then we match to like who's available. Uh, Geographically, we go by as well because we cover all of Grey Bruce.
Okay.
Yeah,
That's important.
yeah. I think our furthest client's Tiverton. We got a couple in Thornbury, two individuals in Lake Eugenia.
Oh my.
Yeah,
Yeah.
we're all over Grey Bruce.
You must have had some challenges this winter then.
Yes, we did.
It
Uh,
was quite the winter.
it was quite the winter.
Yeah, for sure. So, basically, you mentioned about the demeanor of the staff as well, because that personal relationship, I would think, would be important as well as the care for the person. There has to be a relationship because you're in their home, which is different than them being in a hospital or a clinic.
Right. And we try to even make sure the same staff go to the same people too.
Okay.
So that we eliminate the revolving door as much as possible.
Yeah.
I mean, there's been a few times it couldn't be helped
Yeah.
for a variety of reasons. But for the most part, though, we keep the same staff. We try to keep a minimum like one staff and one backup.
Okay.
Yeah, then that way you don't miss a beat. They get covered. But it also depends on the volume of care and hours they need. Like if they need 7 days a week with like 7, 8 hour days, well, then you're going to need three staff.
Yeah. Yeah.
We've had a few around the clock care
Yeah.
individuals. Like usually those are temporary. We had one that went on for about 5 or 6 months though.
Yeah. Yeah.
But, each
So
need is different.
it certainly sounds like you're quite fluid and flexible about how you need to make this work.
Right.
People coming home from the hospital, do you ever provide or are you ever there to help them make that transition after a hospital stay?
Yes, we do.
Yeah, yeah.
Yes,
So that's
actually
another,
quite common.
yeah, yeah. I want to talk to you. We've got about 5 minutes left in the program.
Okay.
So I want you to be sure to profile what you want, but I'm interested in your future plans because obviously there's always changes. It sounds
Right.
like well, anything up your sleeve, Jeremy, that you want to share.
Oh, if I could expand past the Great Bruce into like Collywood and past, maybe as far as Godrich,
Yeah,
that would be nice. I know any kind of growth will happen organically and naturally. So what I do is as much as I like to network and advertise and get out there, I don't force the issue neither.
okay.
Everything just from where we last talked and met to where we are now, it just happened.
Yeah,
And
yeah,
now that I'm well known and established in the community and even throughout the Grey Bruce area, are getting even more out there.
yeah,
It will just happen naturally, you
yeah,
know, as the
yeah,
needs continue to increase and grow. And yeah, so I would like to, and we're almost to the point where even because I'm too busy in the management side, I'm doing less of the hands-on work than I used to be.
mm-hmm.
It was hard doing the full-time client, and then still trying to manage it. So that's why I needed some managers and some team leads to come and help me with. But I would like to see to the point where I can be stretched all over Grey Bruce as possible, even further out.
Yeah.
And still realistically trying to keep on the management side and continuing to keep on finding extra training for the staff as well.
Yeah, and I think that's really, really important because it just enhances the programs and services that you're providing. So certainly future plans, you're open to the possibility of being more geographically spread, as far as the service you provide. Do you anticipate even more of a need? I mean, we are an aging population, there's no doubt about it. Do you anticipate more of a need for seniors, especially if their families live further away?
Yes.
Yeah. So that the numbers may grow as well.
Right.
Yeah. So from your perspective, your decision to stay in the area, to grow your business, but also to expand the community connection has worked out well for you. Is this something you would encourage others whom we're always talking about? We want to keep businesses local. Is this something you would encourage as well? Not necessarily as a competition, though.
Absolutely.
Yeah.
Yes, I feel that, especially with what I'm doing, there's very few of us doing it in the area, so that helps.
Yeah.
And even though I nearly went back home, I could see why I didn't go back home. And even at that point, I'd been up for 14 years and I'd already been changing my life here as it was. So it would have been hard to make that transition back to my hometown anyways.
Yeah.
But not only has the business grown and I've become well known in the community, I would go on to meet my now wife and the daughter here. So
Yeah.
And I could say I've been in Owen Sound for 25 years now.
Excellent.
Yeah.
So anyone who wants to learn more about their services can call and speak to you or someone, or go on to the website as well, because you do have stories about and testimonials from people that you provided services, or the families have commented on the services as well. So
absolutely, and I know that's when our biggest success is, when they're emailing me testimonials or Google reviews, or even when the staff are mentioned by name in the obituaries that they made a difference to their loved one, then I know we did.
You've set out and accomplished what you want to do.
And even when you get dragged into a family argument, they love you. That's happened a couple times. I'm like, okay, we're part of the family.
Jeremy, I want to thank you. Our time is up. It's gone so fast. I want to thank you for spending time and talking more about the services that you provide. I wish you all the best in your future endeavors as well.
Oh, thank you so much, Carol. Great to be here again.
Thank you. And thank you to our viewing audience for joining us today to learn more about programs, resources, and services available to you and to your family. Take care and stay safe. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Hi, I'm Carol Merton, host of HealthLink on Rogers TV. HealthLink connects home, community, and healthcare with interesting topics and speakers about your health and your community.
Are you a passionate content creator ready to expand your audience reach? Do you have unique stories, captivating hobbies, or special interests that deserve a spotlight? Rogers TV is here to amplify your voice within the community. We offer you the platform to broadcast your content to a wider audience. And the best part, it's completely free. Don't miss this opportunity to share your vision and engage with viewers. Find out how Rogers TV can transform your content journey today.